morning and welcome to Fall Prevention Fridays. I just wanted to talk about fall prevention this week as we have launched a new program. Oh, maybe it just now started. I don't know, I'm not very good at this. Good morning and welcome to Fall Prevention Fridays. Something we're going to do for the month of June to talk about fall prevention and do a little education on what that means and how it can help. So I did mention earlier in the week that we started a fall prevention program and that we're going to be launching that in the month of July. But I realized that nobody really knows what fall prevention is, and if they do, it's because they've already had a fall. Usually that's when we become aware of fall prevention or what we could have done to combat the fall. And that's just something that it's been on my heart to create a program because I don't quite get why we talk a lot about fall prevention after the fall. So I want to start talking more about fall prevention prior to a fall and hope that we can prevent quite a few falls. So I'll start by reintroducing myself because I do know that we have some new followers on the page and I don't know if everyone knows. So we are Healthcare Straight Up and I am Jessica Henry. I'm an occupational therapist and I practice in the Tampa Bay area. So I specialize in fall prevention, home modifications, caregiver training, and that's kind of what I do and why I'm really passionate about fall prevention. So we're going to get started. Just a couple, I want to talk about risk factors for falls. So you might have been told that you're at risk for falls, or you might kind of notice certain things like, oh, I almost fell the other day, or something that happened that you might have started to take notice, and it might not be a big deal. You might not even think it's that big of a deal, but actually the risk factors can be so much so as the type of shoes that you wear. It can be your age, your gender even can determine if you're at a higher risk for falls. So there's lots of different factors, your diagnoses, there's so many different things, but oftentimes it's not just one specific factor that makes us at a risk for falls. So it's not like when you turn 62, all of a sudden you're at a higher risk than when you were at 61. It's a combination of the shoes that you wore, the imbalance that you occurred because of the muscle weakness, because of just a lot of different things. Maybe your vision was bad that day. There's so many factors. So falls are typically what they call multifactorial. So we'll never be able to eliminate all of our risk for falls, but we can reduce some of our risk for falls, and there's a lot of things that we can control. So the first thing I'm going to be starting to talk about is kind of exercise and the benefits of exercise and how it's directly linked to fall prevention. But first, I kind of want to give some statistics, and I know that sounds boring, but it's so prevalent, and falls are such a big cause of why people lose their independence. And that is a big thing that we do here at Healthcare Straight Up. We want to make sure that the seniors and the older adult population stay in their homes, age in place, get to do all the things they want to do without having the fall, or without having the fall that leads to an injury, or it's just so many things. So what exactly is fall prevention? And let's talk about some of the statistics, okay? All right, so fall prevention is any action to help reduce the number of accidental falls. So this can look like exercise, it can look like a specific program, it can look like using a walker if that's what's necessary or deemed appropriate by a therapist. It can also look like a lot of things really. It can look like actually listening to your blood pressure medication guidelines. There's so many things that go into fall prevention that we don't even think about. So actually following those guidelines, paying attention and knowing if you're at a risk for falls. So we just shared the other day about identifying your risk. So if you're at a high, moderate, or low risk, knowing where you're at and what risk you have is an excellent place to start, because oftentimes, again, like I said, we don't really know. We don't really have any idea if we're at risk for falls or how that's going, because we just think, oh, that's normal, I almost fell, or oh, I'm having a bad day. And really it could be something that you could change or modify or work on to reduce that risk. So that's kind of the things that we're talking about. And why is it necessary? Why is fall prevention necessary? Obviously we don't want to have a fall, but the things that happen after a fall are, so you have the fall. The fall results in an injury. Injury results in loss of independence or lack of socialization because you're not going out as much, and less mobility, so it actually increases your risk for another fall. There's so many things that kind of stack on top of each other, and it creates this snowball effect from the first fall. So just a statistic, 30% of Americans over the age of 65 fall each year. So this doesn't mean that each of them gets a catastrophic injury, but that is also what we want to prevent. So you're also more likely, the number increases to 50% after age 80, so you're more likely to fall as you get older. And then once you fall, you're 3 times more likely to fall again. So we want to prevent the first fall. We want to be doing those actions and those activities and those exercises, those things that you can do yourself or with help to reduce your risk in the first place. Because pretty much this can put you, falls can put you at risk for a hip fracture, a head injury, or even just, like I said, lack of mobility that leads to you not getting out of the house anymore, which we know leads to depression and increased risk for a lot of other disabilities and diagnoses. So that's not what we want to do. We want to actually maintain and keep up our activity level and keep doing, okay? So that's where we're going to start talking about exercise and how it directly coordinates to fall prevention. Okay, so let's talk about the exercise part. So there's so many benefits to exercise. I'm just going to list a few. So it promotes sleep, improves mood, reduces stress, promotes weight loss, reduces risk for diseases such as diabetes, stroke, high blood pressure, and so many more. So exercise we already know is so crucial. We know what it does for us. We know how it's helpful. But the problem is it's hard. It involves, you have to show up and do it. You have to be ready to do it. You have to know what you're doing. Sometimes you need modification. Sometimes you need help. So a lot of these things we don't realize, but the difference for fall prevention is that it's something that you can actively do to prevent the fall. So if you put off exercise, okay, I didn't lose any weight. But if you put off exercise for too long and you become less mobile, then you might actually increase your risk for falls. And like we said, all the things that come with that. So we're going to talk about specific exercise that have been linked to reduce the risk for falls and how we can start, okay? So the first one is kind of what you should be doing. So standing exercises versus seated exercises. So we should be doing standing exercises if we're wanting to protect our fall risk. So standing can be anything. You can be holding onto a countertop. You can be having no hands. You can be near a wall so that you can touch. You can be standing on one leg. You can be doing marching in place. Ultimately, standing is just the key, because if you do a seated exercise, yes, you can do like 30 leg kicks and do them in sitting, and you can progress those as you like, but you will not ever be focusing on your balance. You'll be focusing on your strength, which is great, and you need that as well, but you really need to also focus on your balance. So standing exercises are key. So that's the first one. The second one is the progression. So just because you do, like, say, let's use marching in place as an example. So just because you do marching in place exercises, so you're marching, you do that for 30 seconds every single day. That is great. That is a great place to start. And even if you can't start in a standing exercise, yes, we encourage you to start in a sitting exercise, but towards progressing towards standing. That's what we want, because that's the only thing that's going to improve your balance. So, but the progression is you can progress by adding repetitions. So you can do more, you can do 50, you can do 100. You can add the frequencies. You can do it 2 to 3 times a day. You can add weights. So they actually have ankle weights that you can take out different slides and, kind of upgrade as you go, or you can even just get 1 pound and just always use the 1 pound, but do more. Ultimately, you want to be standing and progressing your exercises. Okay, so that's the 2. The last one is what we all know. I'm sure you're ready for this one. Consistency. You have to be doing it often. So just because you start doing exercises today does not mean that all of a sudden, well, I'm not at risk for falls anymore. No, unfortunately, that's not the case. Especially, like, I wish that worked for weight loss too, but it doesn't. So you have to show up consistently. So you need to kind of help, and this may be helpful to have somebody to be accountable with. Talk to somebody. All right, I'm going to start doing these exercises. I'm going to start walking. Will you walk with me? Making someone aware of what you want to do and what you can do and the goals that you're setting out for yourself. So that's one of our big things, and that's kind of why we created the fall prevention program, is because a lot of the times you don't know what to do, and it's a lot harder to do it on your own. So if you can, get somebody to help, talk to a therapist, talk to a friend, just get going. So standing, progressive exercises, making them more difficult, and consistency, okay? So I hope that helps. That's just kind of my quick blurb on fall prevention today. Stay tuned for next Friday around the same time, and we'll talk more about fall prevention. So see ya.